A podcast. What is the word?
A podcast by Kalugo.
A podcast. No. By Galuga.
Yeah. Hi, I'm Christy, host of Today We Tried, a parenting podcast from Kalugo where this season we're taking a deep dive into the fourth trimester and really beyond, because we all know postpartum lasts more than 12 weeks. I'm excited to be back and cannot believe that Thanksgiving is next week, and to share my interview with Alison Workman, a psychiatric mental health nurse practitioner at the Motherhood Center. We talk about perinatal mood disorders, what to look out for, and we share our own personal experiences. This episode really encapsulates what I'm trying to do with this season, provide advice and moments of connection to help parents feel less alone and more confident. Here's the key takeaway. In the words of Alison, when in doubt, reach out. If something doesn't feel right, ask for help. Don't just try to push through it, which honestly is advice I should have taken, as you'll hear more about in this episode. Alison shares some really great resources about how to find a provider and lots more. So let's jump in. I'm here today with Alison Workman, who is a board-certified psychiatric nurse practitioner specializing in reproductive psychiatry. She works at the Motherhood Center of New York, where she provides psychotherapy and medication management to perinatal women. She's also a mom of 2 girls, aged 6 and 3 years old, and she's speaking to us from her home in Brooklyn. How are you, Alison?
I'm good. Thank you so much for having me.
I'm so excited to have you here, and I would love to start by hearing a little bit more about the Motherhood Center of New York and the work you all do.
Yeah, so the Motherhood Center is a mental health center geared toward providing support, clinical treatment to new and expecting mothers and birthing parents experiencing PMADs. And by that, we mean perinatal mood and anxiety disorders. And we provide a couple different services. We have an outpatient arm where we have support groups and outpatient therapy and medication management. And we also have a day program, which is sort of an intensive outpatient program. It's called a partial hospitalization program, which is for women that are really struggling to care for themselves and the baby. This branch of treatment is meant to prevent women from having to go to inpatient treatment, which would separate them from the baby.
Are there any inpatient options where moms can stay with their babies? Or if it's inpatient, is it just, maybe there needs to be that separation for healing too?
Well, research shows actually that separation is detrimental.
Okay, I don't know.
Mom and baby.
Yeah, that's what I would think. I just didn't want to presume. Okay, so yeah, it's.
There are 2 hospitals in the United States that have a model where they have inpatient units that can admit both mother and baby. One is in North Carolina, I believe, one of the Carolinas, and the other is Zucker Hillside, which is in Queens. But they, after COVID, have had a harder time keeping that unit staffed in a way that really is able to promote that mother-baby. The ability to admit them both is my understanding, but I know it still exists. They have maybe 3 beds. It's a very limited option.
So you mentioned the term perinatal mood disorders. Is that right? Could we start by just kind of defining some of the different diagnoses that women and birthing people can have in this postpartum period? Because I think that can be really helpful for people to help recognize kind of what symptoms they're having and to just know the scope of things. Because you hear oh, it's just baby blues, or it's this, or it's that. So could you walk through those a little bit so we have a better understanding of kind of the lay of the land here?
Basically, there are a couple different forms of this, of how these kind of mood disorders show up. And there are people for whom they had a pre-existing psychiatric illness, and sometimes that can be exacerbated during pregnancy or in the postpartum period. There are also women for whom never had any previous psychiatric symptoms, and those can start to sort of evolve even during the trying to conceive, depending on how you're trying to conceive, We know that IVF and like reproductive fertility treatment can represent a really intense stressor for both women and couples. And so sometimes that the symptoms can crop up in that time frame. Also during pregnancy, and then postpartum, you can get an incidence of symptoms that are brand new. And what that can look like is postpartum depression, which has sort of most awareness. And at this point, most people think of postpartum depression as being something that could occur. But on the other side of that, there are anxiety disorders, there's postpartum OCD, and then very rare occurrences of postpartum psychosis. So depression can look many different ways. There's the classic way of thinking about depression where people have trouble getting out of bed or completing their like activities of daily living. But it can also be very internal, and you're still able to function pretty highly, but you're maybe experiencing like negative self-talk or feeling very distant from the baby, or not feeling a desire to care for the baby. Can experience like apathy and loss of interest. So those sorts of things are really more on the depressive scale side of things. Anxiety can accompany depression. It can be all on its own. When we think about like generalized anxiety, we usually think of it as tapping into a couple different parts of your life. So, it could be anxiety related to baby-related anxiety or returning to work anxiety. Some women experience throughout their whole leave just like a very, worried feeling about how they'll integrate their life into this now having a baby, like into motherhood. And that kind of anxiety can sort of feel like it's pinging from thing to thing, and that you have a low level sort of intensity around a lot of different subjects. Another form of perinatal mood disorder is perinatal OCD, which can look a lot like anxiety. But in this way, usually the worries are very cyclical. So they're focused around certain things and they reoccur, and it sort of feels like the worry gets stuck on a hamster wheel. And also what can happen with OCD is that it can start in reality, whereas like generalized anxiety is usually about things that are likely to occur. OCD can sometimes start like that, and then your brain can kind of catastrophize them into something that is unlikely to occur. So that's kind of difficult. I could give you more examples, but it's difficult to parse out sometimes. But I think it's important that people know that a perinatal OCD exists and that there's an obsessional quality to it. And in these cases, you might find mothers doing like frequently checking the baby, or really worrying about contamination, or feeling they're the only one who can care for the baby, things like that. Yeah. And the other thing that can occur with OCD is intrusive thoughts. Really common also just in the postpartum period. Many mothers have intrusive thoughts, but they're very particular to OCD and can be kind of excessive in that way.
Well, I know one that I experienced, and when we have chatted before recording, like you said, was fairly common, is that fear of walking down the stairs with the baby and that you're going to fall down the stairs. And
yes.
So that was with my twins, my first babies, was like, I could make it down the stairs, I could do it, but it was such a shock to have this feeling of this fear. And I remember even after the babies got bigger, kind of like when I would see the stairs in my house, I would have this like remembering that feeling. So that's one that, I had, and I've heard others have as well.
Yeah. And that is so common, very common experience to feel that you have that image. What if I drop the baby? Or if you're pushing the baby in the stroller, like what if I accidentally pushed the baby into the street? Some of those are perfectly normal as you adjust to sort of the responsibility of becoming a parent. But if your behavior starts to really change based on these thoughts, right? So you stop taking the stairs, or you become afraid to cross the street, that's when they start to get into psychopathology, and it starts to become something that, is really treatable.
That's a really good segue into thinking about like what to be on the lookout for in the postpartum period. Because as you're talking about this, it's like there's intrusive thoughts are like totally normal and can happen. Like most people are going to experience some baby blues, but it's like, what other things should you be in the lookout for, maybe your partner, because often it's maybe your partner that can really see it before you can, that is a trigger to be like, okay, I need to get some more help here.
Yeah, so it's a very individualized question to some degree, although there are some things that would occur that we could apply to most postpartum women. Again, if you have an underlying psychiatric illness, you'd want your partner to be aware of that and of what those symptoms looked and felt like, so that if those start to crop up again, they're recognizable by your partner. More commonly, most women experience that baby blues period, which we consider to be within the first 2 weeks of giving birth. That can consist of mood lability, crying for apparently, not a big trigger or what people feel like is no reason, feeling emotionally labile, or and by that I mean your emotions switch quickly. So you feel really connected to the baby one minute, feel very overwhelmed the next. A lot of that is also influenced by the lack of sleep. But if these symptoms continue beyond that 2-week time frame, that's when we can kind of say, okay, now we're getting into a depressive zone, perhaps. And sometimes those symptoms look a lot like irritability. You can be overly or not appropriately reactive to the infant. The partner might notice that the mother might be hesitating to care for the infant, or as I said, not allowing others to care for the infant, just seemingly very overwhelmed, very tearful. Often what happens too with partners is that mothers can really target their partner as not being supportive, or as not, doing enough, or, it's like they lose their connection by way of just her feeling so intensely symptomatic. Across all PMADs, if we were going to list a couple things to be watchful for, it would be really intense sleep changes, like not sleeping at all, or not be able to sleep when the baby is sleeping. That's a very big sign of psychiatric illness. Whether it be that she's up checking or worrying, or just doesn't feel the need to sleep, or that it's just out of reach. Appetite changes, like really severe appetite changes, would be something to note. And and making any sort of references to feeling hopeless or despair, or just being really overwhelmed to the point where daily baby care or care for herself is becoming difficult.
It's so interesting to hear you talk about that too, because thinking back to my postpartum, I feel like things definitely past 2 weeks, I was feeling like a lot of those feelings of overwhelm and irritability, because you're not sleeping. And I've talked about this on the podcast before, but I do not have a diagnosis of anxiety, but I think I probably could if I went and got evaluated. And I know, especially after the first time around, I know in postpartum, my anxiety is at a very high level, and I feel a little bit of distance from it. I can almost be oh, I can see myself being anxious, if that makes sense. So that's helpful to me. But I also think I should probably have gotten help. So I'm just, I'm in thinking about people listening to that who are there, and we're going to share some resources later about where to go. But I think part of the challenge here is normalizing asking for help, and I'm not a good example because I didn't. It's also this talking about it so more people can be oh, okay, I can get help. I can feel better. It's not that once you get help, it's forever that's going to define who you are.
Yeah, and I think that there is a concept just sort of culturally of grinning and bearing it. And I think for many women, they also have underlying psychiatric symptoms that were manageable before they were pregnant and postpartum.
Right.
And they might even have been slightly useful to them. Some people with very intense anxiety are very successful in their jobs and at their work. Similarly with sort of subclinical OCD, it's we really, in our culture, regard those sorts of attributes positively, right? You're really digging into your work, you work really long hours, those sorts of things. So then if you pull those things away, there's a lot of excess energy, and it can become pathological pretty quickly. I would say, based on what you've said, you probably could have benefited from help, Yeah, I think we all need help in sort of recognizing and promoting the ability for women to say, like, this is really hard. And it wasn't what I thought it was going to be. And I don't, and I don't really want to do it alone. Yeah. And the other thing is, culturally, we used to do this in groups. We used to live amongst our family in much different ways than we do now. And so I think intergenerationally, women had more support. And in this modern world, you can hire support, baby nurses or postpartum doulas, but typically in many cultures, these were your aunts and sisters and mothers and grandmothers.
So let's talk about some of the tools that you've found like effective for people in these early days to help manage symptoms, baby blues, and just postpartum generally. And I know one you've shared with me is this idea of zooming out and gathering more information. Really resonated with me, and I would love to hear more.
Yeah, I think often mothers and parents, new parents, get very easily zero in on certain aspects of the baby. And so it can be, so common to really hyper focus on feeding, right? Down to the ounce and the timing of the feeds. And there are all these apps you can download where you're entering like length of feeds and length of wake windows and sleep. And, I usually recommend people stay away from apps like those because they do cause this kind of very natural data gathering that doesn't involve looking at the baby, right?
Yeah.
So it pulls away from this sort of very instinctual way of interacting with these little people who are all very individual. For instance, if you're hyper focusing on one piece of data, so let's say, the example I always give is a fever. So if the baby sub 8 weeks gets a fever, you do need to react strongly. But let's say the baby's over 8 weeks, right? So I know we're fourth trimester, but the fever example I think is helpful because when your baby gets sick and you notice the fever, many new parents look at the number, and the number is terrifying. Let's say it's 102, and so it's 102 Fahrenheit, so it's terrifying to them. But we haven't gathered any other data yet. So what else do we see about the baby? Is the baby happy? Are they eating, making diapers, like responding to their normal cues? Are they, all of these things, right? We have other data we can grab from the baby itself before reacting to the one outlier. And so I think that can be applied to a lot of things, and the sleep wake windows, especially, I find many new parents getting very stuck in this idea that if your baby is awake for too long, that their brain is going to start melting.
No, I'm laughing because I was definitely like that with the twins.
Mm-hmm.
It was like they had to be on their schedule. And it's hard too, because that's also like what you're asked about at like the pediatrician too. So that can get like reinforced as well. It is not so much in your control, like how long your baby sleeps or how much they eat, but it's something about the writing it down makes this illusion of control. I remember writing it down and I was like, this is the schedule, but it like, changed every day. And my husband was like, that's not a schedule. That's like you writing time. I'm like, it's almost a schedule. It's like things only vary by half an hour or whatever in either direction. He was like, yeah, that's just you writing things on a page. I was like,
down.
Okay. Yeah.
I know. I always find myself saying like parenting is a moving target. So we can't, and I also really feel strongly that we're selling the infants short when we do this kind of very like analytical way of sort of caring for them, because they're little people that haven't unfolded yet. They're all just as individual as we are, right? They have little personalities and likes and dislikes. And, in the presence of anxiety in particular, it can be helpful to just move to a more intuitive way of interacting with them, and sort of learning what their wake window might be, which might not be whatever this app has decided is perfect for every single baby,
I would love to dive a little bit more into infant feeding because it's so much of your relationship with the baby when they're first born, since they're eating so
Mm,
often. And it is, as we said, not really in your control, but you want it to be, and you want some predictability, and it can be, I know it was a big source of anxiety for me. And then such a relief as you move to like, as they turn one and you're like, okay, they're like, we're done with either formula or nursing or combination, and like they're eating more food. Like it's just amazing how much they still eat a lot of snacks, but you're not like constantly about those windows. In talking about infant feeding, would love to start with the AAP's new guidelines that recently came out and kind of your thoughts on those and how that interacts with all of this.
yeah, so I think that is important. There's been kind of for a while this campaign of breast is best, which often made many women feel somewhat pressured to breastfeed, and many hospitals, by way of hoping to support breastfeeding, sort of sometimes women would come away feeling like they were pressured to do it rather than to formula feed.
Well, you call it, the whole campaign is a baby friendly hospital, at least in my area. And then so you hear baby
Mhm.
friendly. When I was pregnant with the twins, I was like, oh yeah, I definitely need to go. I was in 2015. They were born like early 2016. So I think this was right when this was rolled out. And I was like, oh, well,
Mhm.
I definitely need to be at a baby friendly hospital. I mean, who wouldn't
Why
want
wouldn't
that?
I?
Yeah.
Yeah.
But then the consequences of that have swung, I think, a little too far.
Yeah, it seems like they have. And I think it was well intentioned, but it seems, yeah, that the campaign for it has gone too far in the other direction. And then more recently, the AAP recommended breastfeeding for the first 2 years of life, which the WHO has been recommending for a very long time. But within the United States, in comparison to some other developed countries, we have fewer supports for women postpartum, for working women postpartum, for any of them, right? But we have very little leave and almost no, we have no universal leave. And some of these other countries have a year or a practice of even women taking 1 to 2 years off. And so in that way, they are, set up for more supports, for more breastfeeding support, just by way of being with their baby for much longer. Well, I think no one would argue that 2 years of breastfeeding isn't beneficial. It sets up, from a mental health perspective, it can set mothers up to feel pressure to breastfeed and to feel like failures if they don't accomplish it. And in that way, I think it's really important that we do work on sort of this language around it to just make sure we know feeding the infant is what's most important.
I think there's a very all or nothing setup with breastfeeding. Either you exclusively breastfeed or you do formula. And I have found the best for my kids and for my mental health is to supplement so that I don't feel all of the pressure on nursing. So I'm
Mm-hmm.
like having formula in the house makes breastfeeding better for me. Because I'm like, okay, we can
Mm-hmm.
make a bottle if we need to. I don't have to it's not all on my shoulders. It means my husband can help with feeds, and every baby is different in terms of how this works. My babies have all been willing to move from bottle to boob. That's been okay. So I just think it
Totally.
isn't like so all or nothing in this way that it's sometimes I think people who are advocates for breastfeeding make it seem so difficult too, in this way that I don't quite understand. Because I'm like, they're like, oh, never introduce a bottle, or else
Mm-hmm.
you're doomed. When my twins were in the NICU, a lactation consultant was telling me that I should ask the doctor to place a feeding tube before it was medically indicated so that my son would never get a bottle, because if he got a bottle, I would never be able to nurse him. And I was like,
Yeah.
no, I'm not going to do that. He did not nurse for the first 8 weeks of his life. And then I was like, oh, let's try breastfeeding. And he did a good job. It was fine.
Yeah.
So it can work a lot of different ways.
Yeah. And I think that's a really important point too, that like they are more plastic than we're giving them credit for, the
Yeah.
babies, and that's again the same point I was making about sort of looking at them as a whole being. It's another instance where we can trust them that they can develop a new skill after, 6 or 8 weeks of life. And yeah, the messaging around when to introduce the bottles, or whether or not to fear a pacifier, or whether to introduce the pump for reasons around developing your supply. Again, these are all things that are not like frozen in blocks of ice. Like these things can change over time. And that for many women, they encounter this really quickly right after giving birth, because many infants lose near 10% or over 10% of their birth weight. For some women who have a cesarean section, their milk may not come in right away, and then their baby may have needs that exceed what their body makes. These are moments that are really important to consider introducing formula. It might be useful for you to get yourself over this hump. It doesn't mean you won't be able to reestablish the breastfeeding relationship. But also you might find exactly what you said, that the combination provides more freedom and an opportunity for dad or the other parent to participate. And the other thing that so doing a mixture can offer is more sleep for mom or for the birthing parent. And that's super, super important for anybody that has any underlying symptoms. We generally, if somebody is in our care and we know that they had a pre-existing psychiatric illness, we basically recommend a minimum of 4 to 6 hour stretch, like right away, so that's not always compatible with exclusive breastfeeding.
Mm-hmm.
There are some mothers who can push through that first 2-week period with getting maybe 3 or close to 4 or pushing depending on the infant, but it's not possible always. And so there are often times where psychiatrically we recommend the combo for that reason.
Sleep is just so critical and so hard to come by in those early days and weeks, but
months.
Yeah, I'm just thinking, yeah, I've been had good night's sleep for a while. Yeah. But it's just it makes such a difference in all aspects of life, and it can feel like you're not supposed to prioritize that, even if it has to be this idea of you can't pour from an empty cup. Like, you'll be a better parent, a better partner, like if you need to frame it that way, if you're not willing to do it for yourself. The sleep makes such a difference. And also, your baby having enough to eat will make your baby happier and not so fussy. Like, the first time I gave my daughter a bottle with formula, I swear, she was only a few weeks old, but I swear she full on smiled and fell asleep and was like, I am satisfied. Like, I'm no longer, the witching hour became a lot better because they had enough food and
right.
It's just, but it's
happy,
it's so hard. Yeah. It can be so hard in that moment to look at that way, because it can feel like such a failure if you thought what you want to do is exclusively breastfeed.
Yeah, I mean, I had that with my first baby. My mom was a lactation consultant, so I always had an idea that I would want to breastfeed. I grew up around midwives. It was something I was really heavily exposed to, and it just didn't occur to me that it would be something that would be so difficult. And it was incredibly difficult for us. And she did lose over 10% of her birth weight. And we were recommended to spoon feed her and then syringe feed her. And I felt anxious about introducing a bottle because I had gotten that messaging, and even a bottle of my own milk, because I was making plenty of milk, which I was fortunate to be making. Too much, actually, which was a bit of an issue as well.
Yeah, because that can be really hard too. I mean, I have never had that. I'm always just enough, but I know that oversupply can be a huge challenge too.
Huge challenge. And when you have a baby who's not latching well and you're fire hosing them, it's very difficult. And if she was a little weak, and so it was just very complicated. And looking back and remembering some of those, the middle of the night interactions just with my husband and mother, I wish that I could have gifted myself a reprieve, because it was so intense, and looking back, it feels unnecessarily so.
And so you were doing the triple feeding thing?
Yes.
So that's when you nurse and then pump and then give them a bottle to kind of top them up. And I
Yeah.
think something I didn't realize until having babies is like, as we're discussing, like how often they eat. So if you're doing that cycle, you're like starting that cycle again, like 2 hours later tops, essentially,
Sometimes
because they
less.
sometimes
Yeah.
less. I know it's so, I'm just like, this is bringing me back. Like
Hmm.
yeah, it's so much, and you're not sleeping and you're not, and so setting a time frame on some of these things can also be good, right? Because like the days can feel so endless to begin with. And if you're like, okay, I'm going to try this for like a week or something, I don't know, give yourself some cutoffs, I guess, maybe.
Well, the triple feeding program is supposed to be time limited in its recommendation.
Okay.
So the lactation consultant should give parameters for how long to do that. And if it's just like until your supply is up or something, then you might ask them for more directive instructions for when to stop. But I wouldn't recommend anybody do it for longer than 10 days. Really. I mean, I think 2 weeks is the real top, but if you're really doing that day to day, many women don't last for more than 5 or 7 and then feel like whatever they did wasn't enough because it was felt like they did too little.
Yeah.
But it is such an intense program. And if you're put on a program like that, it's highly likely that your infant is also screaming at the breast
Yeah.
because they're hungry and having difficulty gaining enough in each feed. And so not only are you working so hard to try to get everything in a row, right? All the milk that you need and pumping and doing everything like exactly as it's supposed to be done. You also, every time you latch your baby to your breast, it's painful and full of tears for both
Yeah.
of you. It's just really hard. I just wish I could have gifted myself topping her off with formula. I think that would have been a really nice thing.
Well, this leads into maybe, maybe not, but I don't know. And what motivated you to get into this field? I don't know if it was partially that experience or if you were already in this field before, but would love to hear more about how you how you came to work at the Motherhood Center.
Yeah, actually, it was my first daughter. Prior to my first pregnancy, I worked as a school nurse, which I loved very much, and thought I was going to do it for the rest of my life, just because it was such a fun way to be a nurse, to interact with the kids when they're all healthy, and there was a lot of psych involved, and I had a really great schedule. So I thought, being a mom and having every summer and every vacation off, why wouldn't I do this forever, But then I had my first, and I had a lot of obsessional anxiety during my pregnancy with her, but I had no idea that's what it was. Postpartum, she lost all that birth weight. I am, really hyper focused on breastfeeding. And yeah, and then subsequently really did also experience a lot of really heavy sort of just obsessional anxiety. I had trouble letting others care for her. I really felt that I couldn't be apart from her. I did find myself, waking and frequently and checking on her and those sorts of behaviors. And it was also my first baby, so it was so difficult for me to recognize any of what was going on for me. But what happened, which is interesting, because at that time I had no idea that I, was experiencing clinical level of symptoms likely. But I felt after I gave birth to her that the whole experience of giving birth, of making this human and then bringing her home and sort of just seeing what a wonder she was, and then also the physical and existential shift that occurs when you enter motherhood, to me was so profound that I felt I had to do something about it. And I didn't even know what right away, but I was just like, this thing that is happening to me, nobody told me about this. I had no idea it would feel like this. I had no idea, like, just how sort of like emotionally rich it would be, both in the positive and the negative. Sometimes not negative, but like intense, maybe.
Mm-hmm.
I couldn't stop thinking about it, and I just realized I have to do something. I have to do something in this space.
That's incredible. So before I let you go, I would love to hear, we've talked a lot about kind of things to look out for, challenges, joys, all of that. So if you're listening to this and you're thinking, maybe I need some help, maybe I just need some additional resources, where would you recommend? Because, the Google search is a dangerous thing. Facebook groups can be trouble.
Intense.
So yeah, the good and bad thing about a Google search is you can probably find whatever you want to find, to validate. So
Whatever you're thinking,
whatever fear you have, someone's going to validate that. So it's better to go to trusted resources and not the general search. So where would you recommend listeners turn?
First, I want to just say, if you do find yourself excessively researching baby items, baby things that are happening to your body while you're pregnant, that's a pretty good sign that you could reach out for some help. That's a really telltale symptom, like excessive researching and just rabbit holing. Even definitely if you're in the New York area, you can reach out to the Motherhood Center at themotherhoodcenter.com. Also, our phone number is 212-335-0034. And if you're not in the New York area, you can also reach out to us and we'll help you find referrals wherever you live. But aside from us specifically, there's also an organization called Postpartum Support International, and they have courses actually for providers, but also, which is important because they can, and lots of providers, like you could do any type of therapy or anything tangentially related to mental health and take one of their courses and learn more about perinatal mental health. And the other thing that they have is a provider directory. So you could search by your area and find out if there are any providers that specialize in perinatal mental health. The other resource I would recommend is called mothertobaby.org. And here you can look up medications or exposures to like even beauty products. They have like little succinct fact sheets with the latest data on any of those things. So that's something that we actually use in our practice. We often give mothers this fact sheet on like based on one of the medications they might be taking. That can be helpful and reassuring. And the final recommendation I would make is for Mass General in Boston has a Center for Women's Mental Health. And so they also have a wealth of information on the latest research on medications. They also have a registry for pregnant and breastfeeding women who are taking medications, and you can volunteer your information to that registry, and that helps us build on the data that we have to treat women. And they also have a very important project on postpartum psychosis, which is something I mentioned but didn't talk a lot about. Given this diagnosis, Mass General is basically asking women who've experienced postpartum psychosis, an event within the past 10 years, to join that registry again to sort of expand our knowledge.
All right. Well, thank you so much, Alison. I really appreciate you taking the time to chat and share so much information and knowledge with everyone. So, and the work you do every day. So thank you.
Yeah, thanks. Thank you so much. And I would just say, like, when in doubt, reach out. If you think that something's funny or it's not what you pictured, or you don't feel bonded, or it doesn't, it cannot ever hurt to reach out for help and just at least talk to someone about what you're feeling.
Today We Tried is brought to you by Colugo, a baby gear brand founded by parents for parents. I'm your host, Christy, and our producer is Mike Pilak. Stay tuned for more, and in the meantime, remember, you got this, and we've got you.